All right, welcome to Medicare Bootcamp. Welcome back. We're in video 5. We're talking about Medicare Advantage plan, also known as Part C. So we've discussed A, hospital, B, medical, D, prescription drugs, and now Part C, Medicare Advantage, which for the most part includes prescription drugs, um, and a lot of other things that original Medicare just doesn't. So we're talking about dental, vision, hearing aids, gym membership, grocery card, um, over-the-counter allowances, and even things like transportation. And there could be others. It just depends on the plan and in the area and what's offered where you're at. So, yeah, these are the kind of all-in-one. And again, these plans are typically $0 premium. There's two types. You'll either have an HMO or a PPO. An HMO basically it's a closed network. It's a health management organization where your primary care physician will refer you to other doctors within the network. This is going to be probably the lowest cost option to any recipient. Okay. The PPO is a little bit different. This is a preferred provider organization. You don't need that referral. You can just go to a specialist. You will have higher copays in a PPO, but now you aren't restricted to your network. You can actually go out of network. You just need to find a doctor that is going to agree to take and bill your insurance, your PPO plan. They need to be Medicare approved doctors. But if they have that agreement and they'll bill your insurance, then you're free to see them. It's not free, however, because you're going to pay probably a higher copay than on an HMO plan. And you may even have a copay on your primary care physician in a PPO. It just kind of depends. So in these plans, also you need to be aware that the facility that you're going to as well could be out of network. And those hospital and outpatient and other procedures could be much higher and be, kind of price you out, or at least you want to be aware of what are your in-network options when it comes to all of that. And again, I would recommend working very closely with your provider, your insurance carrier, to see what your in-network options are because it's going to be a lower cost to you. So again, we need to weigh out the whole amount of information, your preferences, because if you have a specific doctor that you just need to see, and that's then we'll figure out a way that you can actually see that doctor, hopefully. Okay, so these plans are zero cost, like I said. They cover all of these extra benefits, and yeah, I think that's about it. Looking over here. Yeah, so again, we're going to take a look at what your preferences are. Keep in mind, though, in these Medicare Advantage plans, it's a pay-as-you-go system. So you will probably not have a copay for your primary care physician, but a specialist you would. You have these procedures, different things. You would expect to pay co-insurance or copayment to go. You pay as you go system, right? And so the next video, we're going to talk about the supplement plans, which is you pay on the front end versus pay as you go. So at the end of the year, you're going to have a static amount that you'll be paying out. And so we'll discuss that later. And then the video after that, we'll kind of compare the two and do some Medicare math. Okay, so if you have not yet done this, go click below, get the Medicare readiness checklist. This is something that's going to help you and your agent find the most optimal plan. And this a tool that's going to just help anyone that uses it. This is basically the system that I use for all of my clients. And if you would like me to be your personal client, I'd love to meet you and see what we can do for you. There is a way to click my calendar below, sign up for an appointment. We can talk together on Zoom if you're comfortable with that, or just phone call, whatever your preference is. You can even check out my site to look at plans, options in your area, Keep in mind, October 1st, there's going to be new plans available for 2026. For the annual enrollment period, you'll want to take a look at that. Yeah, you can reach out to me however way you like. Okay, that's it for now. I will see you in the next video.